So vital signs, we all know what they are. We all have dealt with them. We know that you can get a pulse by your ear, right here, temporal or temporal, depending where you're from, a carotid in your neck. You always want to feel on the side that you're on with your fingers this way, not this way, not across, but on the side that you're on, fingers upright. You can get a brachial, which is right in here. That's done especially on infants and peds, right in there, or in here, brachial right here. Feel it right there. Okay, on an adult, on an infant or toddler, you're going to feel it right about here. On me, because I have old fat arms, you can't feel it there, but you can feel it right here. You have the radial, because radial, thumb, radius, right there. You also have ulnar pulses on the pinky side of your hand. Those are tougher to find, but you can find them. Femoral, which I'm not going to demonstrate. Popliteal, behind the knee. Posterior tibial is like right behind and under your ankle bone. And dorsalis pedis, which is on the foot near the fourth toe. So that's all the places you can take pulses. Blood pressures can be taken in both upper extremities. They can also be taken in legs if need be. You never want to take a blood pressure in a patient's arms that has an IV if possible. Sometimes they'll have lines on both sides and you don't have a choice. Never, never, never if they have a dialysis shunt on that side. And if they've had a mastectomy. They've had a mastectomy, you cannot use that side. Now, some women have had bilateral mastectomy, so then you ask the patient which arm you should get the blood pressure in, because their doctor will tell them that they should get the blood pressure in the right or left. And the patient will know which one to use. So we all know that normal blood pressure is 100, 110 over 60 to under 90. Normal pulse for adults, 60 to 100. Temperature, we want to talk about temperature. Temperature is important. You have a patient who comes into the emergency room with chills and fever. You want to know what their temperature is. You can take their temperature tympanically, which is into the ear. Some ERs have a scanner that you just run across the forehead, and depending on which facility you work at. And if all else, you can sometimes have to take a rectal temperature. Rectal temperatures, if you do take a rectal temperature, you never, ever, ever take your hands off that thermometer. You do not put the thermometer in and leave it. You always keep a grip on it. If you're doing a rectal temp on an infant or a toddler, make sure that, if possible, the parent's there to help hold the child, because you don't want them wiggling too much. So respirations, normal respirations for an adult are 12 to 20. You want to count both the inspiration and expiration as one breath. So 2 breaths. So normal 12 to 20, remember that. And normal temperature for a human, 36.5 to 37.5. Orthostatic vital signs we'll talk about next.